I want to start off with the overall portfolio budget statement for mental health. And there appears to be a fall off in mental health funding in program 2.1, where we go from $700 million in 2016-17, 717, 17-18, 730 in 2018 and 19, but then in 2019-20 down to 547. So
it's a transition to the NDIS.
Okay, so what exactly has been cut to have
There's been no cut. There's been a transfer of portfolio responsibility for two programs that are currently in the health portfolio, are formally transitioned to the NDIS.
So what are they?
It's Partners in Recovery and Day-to-Day Living. They're the two program areas. That is the reason for the drop-off in the expenditure.
Okay, so, but there's no increase in funding, so in the NDIS to account for those?
Well, we are simply transferring what is currently in our forward funding profile. It is being transferred without savings to the NDIS.
Okay, so the total funding package for those two programs,
is
Partners
transferring
Recovery
to
and
the
Day-to-Day
NDIS.
Living, has
That's
been
right.
transferred over to the
Yep.
NDIS. What happens to the people who are currently accessing Partners in Recovery who are ineligible for the NDIS?
Well, at the present time, we're working through a transition program where we've got we're providing in-kind contributions which is essentially we are holding those funds. Those funds are being distributed through a range of locally based organisations, some through former Medicare local and PHNs, others just through other locally based groups. And we are working very closely with our colleagues both in DSS and the policy perspective and the NDIA to ensure that the transition arrangements and the funding that goes with them is smooth and that nobody misses out on.
So those transition arrangements, so they're not in place at the moment, though?
They are in place at the moment,
Okay.
and they're being dealt with by.
Where are
Can you
they
just
being?
let me finish the question? We are making an in-kind contribution. So what we're doing is actually more or less shadowing the way the scheme will operate in the future. So we are merging into the NDIS world, and so we are holding the funding. And at that point in the forward estimates that you identified, the funding and the programs will then shift to the NDIS, and the current kind of continuity will shift over with the scheme.
Okay, but I want to know, I could see that for the people who are currently accessing Partners in Recovery who will be eligible for the NDIS, that they will be covered. Mm-hmm. How about the people who are currently accessing Partners in Recovery who will be ineligible for the NDIS?
Do you want to do that?
Yep. So, Senator, you may be aware that there's a Council of Australian Government's commitment to ensure that people with a disability or, in this group that you're talking about who are currently receiving services are not disadvantaged in the transition. And these program clients found not to be eligible for Tier 3, which is the client group that you're really talking about, will continue to receive support consistent with the current arrangements.
So where is that being funded from?
So there's some residual funding in the Partners in Recovery and Day-to-Day Living, which is being held in the portfolio, and there's a process in 2 years after in 16-17 or 17-18 to review the transition numbers and to consider whether that residual funding needs to be changed as a result of the trial process.
So that's not reflected in the budget at the moment?
Is
the quantum of that residual funding in the budget papers somewhere?
Yes, it is. So within that overall figure of the mental health funding going forward in the fourth year, when the NDIS is expected to be fully operational, there's a small residual amount of funding left from those two programs within the health portfolio. But that figure may well be adjusted when we have a clearer indication of the percentages of clients.
So what's that current figure then?
It's around 13 million.
13 million?
Yes.
Okay. and so you may adjust that. So that's your expectation of what would
Senator,
be required?
I think there's a very orderly process that we're going through with BSS and with the agency to transition our programs. We are making appropriate adjustments as we transition. If we need to make subsequent transitions that are not catered for within the current budget, then that'll be a matter that we'll bring to the attention of government, or DSS and the agency will bring to the attention of government. But at this stage, we're working on the presumption that there will be sufficient funds to be able to effect the transition. But we've also got plenty of time to work through and bring to the attention of government.
What's the total funding for Partners in Recovery per year at the moment?
I'll just see if I can get that for you. We'll find that for you, but if you want to ask another question, we'll get that one for you.
Okay. So, all right, moving on budget paper number 3 on page 28, it notes that the National Partnership on Supporting National Mental Health Reform is ending on the 30th of June this year.
Yep.
So this is another $50 million a year program. So with that ending, is that also moving over to the NDIS?
No, that's an existing national partnership agreement that has come to an end and is not being. It's come to an end, and it's not being continued.
So isn't that a cut over the forwards then?
What it is, Senator, is that there was an agreement struck with the states, a national partnership agreement that had a beginning point and an end point. It's come to an end, and the government's decided that it's not going to be extended.
But effectively, it's a cut because effectively it's funding services that people.
It's a government decision.
It's a government decision.
Right, but it's effectively a cut.
It's a government decision not to continue the agreement.
Okay, but in terms of maintaining funding, which we had been told that we're maintaining the same level of funding for mental health, it's effectively a cut because it's a program that's not being continued.
It's a national partnership. There are lots of national partnership agreements. They all have a beginning point and an end point. They don't all get continued. This is one of them.
Lots of end points under this government. Not many beginning points, lots of end points.
So, I mean, given that the 30th of June is also the rollover date for the PHN's beginning, do you think that it's really the right time to be ending these payments under this program?
These are decisions for government, Senator. We cannot comment on those sorts of decisions. Right.
So, effectively a cut at the same time as we're having a big transition. So, I mean, my expectation is that you will have a lot of people that are currently receiving services who are going to find themselves high and dry.
Well, Senator, we're talking about one national partnership agreement in the context of quite a few $1 billion in spending in this particular space. As Mr Cormack said, we have a range of national partnership agreements, and if you go through some of the others, there's a range of them that will finish at the end of this year.
It's over the forwards. It's $200 million that would have been being spent. That's going $50 million a year.
No,
that is not. No, Senator, it's the NPA has come to its natural end. I wouldn't categorise it as a cut. It's come to its natural end. But I think, Senator, when we look at the $2.9 billion that's just been injected into public hospitals, I think it's important.
I'm talking about mental health.
I know we are, but you're also talking about what you are categorising.
You were trying to tell
what you are categorising as cuts, which is incorrect. So I'm clarifying that for you, Senator, and also putting it in context of other government spending that is significant when it comes to health.
Okay, we obviously we are clear about where the government is headed with that funding. So in terms of the rollover of mental health services into the PHN Flexible Fund, can you just outline so we're clear which programs are being rolled over?
Yes, I'll make a start, and Ms Cole will pick up on that. So there are the youth-focused programs, which include Headspace. There are children's-focused programs, including Beyond Blue. There are... run through the list.
The list is the Mental Health Rural Services Program, is one of them. The ATAPS program.
Yep.
There's some new funding for Indigenous mental health and also for Indigenous suicide.
How much is that funding?
The Indigenous mental health or
Yep.
the suicide funding?
Oh, both of them.
Indigenous mental health is about $84 million, but I can get you the exact figure. The suicide funding is about $6.9 million per year or around that, and I can again get you the exact figure on that one. There is also the Headspace funding. The use.
So that's different from the.
No, sorry, I'm
That's-
just
yep.
going through the list for you.
Yep.
There's Youth Severe, and there's also
So what was that one?
Youth Severe funding,
Yep.
and there's also some funding for community regional suicide prevention programs.
Okay. And I've got a couple of others that people have told me. So the early psychosis prevention and intervention
So that's
centres.
Youth Severe.
That's Youth Severe. Yep. And the mental health nurse incentive program.
And the Mental Health Nurse Incentive Program.
Right. So you've left that one out.
Yep.
So that's the full.
That's the full amount going into the PHNs.
Okay. With regard to the mental health nurses incentive program,
Yep.
that program's been successful because it uses credentialed mental health nurses.
Yes.
How are we going to guarantee that those elements of programs that are successful because of those particular criteria are going to continue to have the same quality when they're being rolled out under the PHNs?
So I guess in a sense the important thing to note is that over time those programs kind of generally move into a broad flexible pool for the PHNs to address the community needs. So in a sense it's more accurate to say that the PHNs have an obligation to provide severe services for people who have consistent and severe problems, rather than saying the MINETS program exists forevermore, if you see what I mean. So I just want to
you're
make that
not
point.
going to require the PHNs to continue to...
Senator, can I just clarify the policy
engage
basis of this?
credentialed
The policy
mental health
basis of this
nurses.
is the National Mental Health Commission undertook a large-scale consultation process, delivered a report to government. Government then considered that report and outlined in November last year a forward direction in response to that. Part of that forward direction was to recognise that while there are a number of strengths with the current programmatic approach, what was more appropriate was to have regionally responsive, flexible funding arrangements that enabled PHNs to be able to commission services in response to local needs. So the intent was not to simply transfer over programs and forever maintain their existing program boundaries or restrictions, because the Commission's report in fact found that those restrictions were problematic. So the premise of your question is asking us, how are we going to implement something that is contrary to government policy? Government policy suggests to us and requires us to move those funds into a flexible, regionally responsive mental health funding pool, and that's what we're doing.
So I'll ask you to wrap up the questioning just with one or two more questions.
Okay.
We can always come back. There are others waiting.
All right,
so we can come back.
two more questions then. So just in terms of, I mean, if you were shifting programs from ones which have been known because of their quality to be delivering very high quality and very effective results, just interested to know how you're going with ensuring that the accountability and ensuring that the PHNs are going to be delivering the same quality of services.
Well, the PHNs are responsible for assessing community needs and to then devise and commission services in response to community needs. So they're required to present to us evidence of their planning, their needs analysis, their forward commissioning program, and a range of quality indicators will be included within each of those schedules. So there are very specific accountabilities for the PHNs to deliver a whole range of sort of quality outcomes across mental health. But I repeat, it's not just simply novating existing Commonwealth programs that have been the subject of significant external criticism and scrutiny and continuing on in a hardwired fashion into the future. That's not the policy intent.
Have you sort of finalised those accountability measures for the individual PHNs in terms of the oversight and accountability the department's going to have?
We have concluded all of our contractual arrangements with the PHNs, including the provision of funding arrangements for all of the mental health funds for the coming contract
So
period.
in those contracts you've finalised then the accountability
Indeed.
and
It's
report
specified
measurements back. Okay, my one final question is about a program called the Children of Parents with a Mental Illness, and my understanding is that funding for the program's ending on the 30th of June. So is that the case?
Got a 6-month extension till the end of the year, Senator.
Right, okay. Is there... And it will
That
end
give us
then,
the-
or will it be reconsidered?
Well, that's a matter for government. It's a consideration for government, a future government, but the funding arrangements have been extended till the end of the calendar year.
Okay, and so by all accounts it seems to be a very successful program. So is there a particular reason why the department has decided to continue?
Well, it's a decision.
discontinue
It's a
the
decision
funding?
of government. I mean, we like a number of programs, they come to an end. Some get renewed, some get modified. Some don't continue. This is one that the government has elected to continue for another 6 months, and no doubt they'll be seeking advice from the department in the lead up to the further consideration of its future past December.
We'll have to leave it there, Senator Ross.